This is going to be the best eye drop tutorial video you've ever seen. Trust me. So, you've been prescribed eye drops and you want to use it properly, but it's going everywhere. Well, not to worry, because Abraham the pharmacist has got you covered, and I'm going to make you an eye drop pro at the end of this video. We're first going to learn how to use our eye drop, but make sure you watch the full video because at the end of it, I've got some really useful pro tips for everyone to follow. Okay, so the first thing you do is you get ready and you wash your hands with warm soapy water. You're about to touch around your eye, and the last thing you want is an eye infection, because nobody wants that. Next, check the expiry on the bottle and make sure that it hasn't been opened for longer than it's meant to be. Also, shake the eye drop bottle if you're meant to. Now, all this information is in the information leaflet. Lastly, open the lid and pop it on a clean tissue because the surfaces could potentially be a bit dirty. Now we're ready, so let's move on to the fun bit. First, sit comfortably in front of a mirror, or if you prefer, do it lying down. Then, tilt your head back. Next, form a fist and pull your bottom eyelid with your knuckles so it forms a little pocket. The pocket will prevent the drop from falling out. Now, the fist is critical for the wrist-knuckle technique because it's like the foundation. So we're able to balance our more dominant hand holding the eye drops and administer it safely. Now let's observe it. Look upwards and rest your dominant eye drop hand on your knuckles so the eye drop is above the eye. But do not let the tip touch your eye, finger, or any other surfaces. Next, gently squeeze one drop into your eye, then close your eye and gently press softly on the inside corner of the eye by the nose with a finger for 1 to 2 minutes. This is called a punctum hold. By performing a punctum hold, it's going to reduce the rate at which the eye drop flows down the tear duct into the throat. So you're going to have more of the eye drop where it's meant to be. So hopefully it'll be more effective. Lastly, screw the lid back on and store away. Now you know the basics, but here are my pro tips that are going to take you to the next level. Tip 1. If you administer a different eye drop into the same eye, wait at least 5 minutes before you do so. Now the eye can only hold a certain amount of liquid in there, so if you administer another eye drop, it's just going to flush down the tear duct into your throat and it's a waste of your medication. Tip 2. If you have to administer an eye drop and an eye ointment, then administer the eye drop first, wait 5 minutes and then administer the eye ointment. Don't do it the other way around because eye ointments are very thick. Tip 3. If you wear contact lenses, never put in your eye drops whilst you're wearing them, unless you're told so by a clinician. So take your contact lenses out, put in your eye drops and wait 15 minutes before you put your contact lenses back in. Now, contact lens wearers should avoid using eye drops which contain preservatives because they'll damage your contact lenses. So speak to your pharmacist about finding an alternative eye drop which doesn't have any preservatives in them. I told you, these tips are pro tips. Tip 4. When you open a new bottle of eye drops, write down the expiry date on the bottle or on the box, and then read the information leaflet to find out exactly how long it lasts once opened, and write down the new expiry date on it too so you don't go over it. This also applies for single unit eye drops that come in the sachet or the pouches, so once they're open they also have a limited expiry date, so check that too. And if you use your eye drop after this date, then I'm afraid you're at risk of an eye infection, so please don't. Lastly, if you're still struggling to administer your eye drops or to squeeze the bottle, because it's quite a common problem, then speak to your pharmacist as they can recommend various different devices that can really help with this. Congratulations, you are now an eye drop pro. I hope you find this video useful, and as always, please help spread the word to friends and family if you think they'll also benefit from this video. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos. So take your eye drops out, put your eye drops in. Did I say take your eye drops out? Trust me. Good timing on that. And you want to use it properly where it's getting, if it comes out.